Hello, everyone, and thank you for joining our webinar today. My name is Annette Fields, and I'm the Executive Director of Vineyard Johns Creek Assisted Living and Memory Care. Today, we are happy to have Dr. Kelli Smith, the Doctor of Audiology, with Audiology on Call here to talk to us about much information that we were not aware of. So thank you so much, Dr. Smith, for being with us today, and I'm going to let you get started.
All right. Thank you for having me. Definitely happy to be here. I'm going to start out telling you a little bit about me, and we'll talk about the hidden risk of hearing loss. And of course, my slideshow is not cooperating. We love technical difficulties. There we go. So October is National Audiology Awareness Month, and wanted to share a little bit with you about the hidden risk of hearing loss. I think many of us can definitely relate to poor Charlie Brown and the way his teacher sounds. I think a lot of people have really become very aware of how much they depend on lip reading or compensating for their hearing by reading lips, because everyone has been wearing masks now for so long. I have been an audiologist since 1993, and I've been in this Roswell area since 1995. I worked in an ENT office for a little over 10 years, and then I spent the past 14 and a half years with a private practice audiology group in Roswell. And then last year, actually around this time, I started my own company and joined Audiology on Call, which you'll hear a little bit more about later. So one of the things that I enjoy doing when I'm not working is hanging out with my dog, Lulabelle. She and I have been doing pet therapy, at least prior to COVID. We did pet therapy with Happy Tails, and that hasn't happened probably since COVID started. So we find our own ways of doing pet therapy with our neighbors and the mailman and the UPS man, and anybody that will say hello to her. The UPS man, of course, is her favorite because he gives her treats. So that's the way to her heart. And she was rescued from Angels Among Us. I have made a commitment as a business owner to donate a portion of every hearing aid sale back to Angels Among Us. It's just such a great organization for animals, and just very, very close, near and dear to my heart. I volunteer with them as well. So getting started, I will be interjecting some humor. I think there are plenty of cartoons to go around about hearing loss and why it's important. We all kind of joke about it, but there is a serious side to hearing as well. And this video, hopefully it will work, does a much better job of explaining the complexities of how our hearing works. So hopefully you guys can enjoy this for just a few minutes.
What do we hear? What is hearing? How do our ears work? And why are hair cells so important, and what happens if we lose them? We hear sounds, vibrations that spread in air or water and stimulate our ears. Hearing is the result of the collaboration between the ear and the auditory brain. An ear without a brain is like an unplugged microphone, but without ears we would not even be able to imagine what a sound was like. Once captured by our external ear, the vibrations cause the movement of the eardrum. Sound is amplified by the middle ear and transferred to the inner ear or cochlea, which transforms the sound vibrations into a neural signal. The auditory nerve feeds this coded message, which contains all of the sound's attributes, to the brain, where different structures work together to create the perception, I can hear. When awake, the process of hearing involves 3 different brain levels: a reflex level, where the arrival of the message may cause us to jump or turn our head, the auditory cortex, where the sound is perceived, and other brain areas which allow the perception to become conscious, recognize the sound by comparing it to those that have previously been memorized, and determine an appropriate voluntary response. When asleep, our ears and auditory pathways are still working and reflexes can still occur, but the other brain regions involved in emotions, motivations, memory, etc. are inactive. There are therefore no voluntary responses or conscious perception. The ear is composed of three parts: the external, middle, and inner ear. The ear canal is closed off by the tympanic membrane, or eardrum. In the middle ear, the eardrum is mechanically linked by the ossicular chain to another membrane, which closes the inner ear. The hearing part of the inner ear is rolled up into a spiral called the cochlea. Sound waves are cut by the external ear and pass down the ear canal until they reach the eardrum and make it vibrate. The ossicular chain then mechanically transmit the vibrations to the liquid of the cochlea. Inside the cochlea are hair cells, which translate sound vibrations into neural signals. By zooming in on a transverse section of the cochlea, we can see the organ of Corti, which contains the sensory hair cells, and one single hair cell and its connection with the auditory nerve. After the sound has been translated by the hair cell, neural signals are sent to the brain through the auditory nerve. Why are hair cells so important? Providing that they have developed normally, our cochlea only contains 15,000 hair cells, and these cells do not regenerate. We can clearly see the hair cells. They are being bent by the sound vibrations, which cause the hair cells to become excited and create a neural signal. Providing that the sound transmission is not altered and the brain works normally, our hearing is fine. In normal hair cells, we can perfectly discriminate the frequencies of sound on the musical scale. What happens when hair cells degenerate? In this image, outer hair cells, the more fragile type, have degenerated. However, inner hair cells are still there. This corresponds to a severe hearing loss and, moreover, a severe loss of pitch discrimination. Language intelligibility is strongly altered. Without the outer hair cells, we can hear some background sound, but barely distinguish the musical scale. Listen. In this image, all hair cells have disappeared. This, of course, results in total deafness. Presbycusis is a progressive hearing loss with age. This type of hearing loss concerns mainly high pitches. When it affects the speech frequencies, it becomes a handicap, usually by the age of 80 or 90. Presbycusis may be accelerated by injury, such as loud noise exposures. Therefore, the handicap may start at a much earlier age, which may result in having, at 40, a 90-year-old cochlea. This sound level scale, in decibels, classifies the sounds in our environment into 4 categories. Up to 80 decibels, there is no risk for the ear, regardless of the duration of the sound exposure. From 80 to 90 decibels, we are getting closer to the danger zone, but the risks are limited to very long exposures. Above 90 decibels is the danger zone. The louder the sound, the less time is needed for damage to occur. Exposure to high sound levels can cause irreversible damage to our hair cells, resulting in deafness and tinnitus. This animation represents the havoc caused by too loud a sound on one of our sensory cells. At about 90 decibels, the hairs may be gradually damaged and eventually the hair cell finally dies. If too many hair cells die, we lose our capacity to hear. By minimizing overexposure to loud noises at work and during leisure activities, you'll be able to enjoy your hearing for years to come. For more information, go to hearinghealthfoundation.org and cochlea.org.
So, as I said, that is a lot of information, and I think they do such a great job of explaining how complex the hearing system actually is. And I'm sorry, bear with me. So hearing loss, again, is one of the most common health issues in our country. It's not one of the more fatal, thank goodness, but it is, I think, sometimes considered an invisible handicap. You know, when people have physical disabilities, glasses or canes or wheelchairs, those types of disabilities, you know, we can see that. But hearing loss actually is considered to be invisible in many ways, but it is important, and it is very common, especially as we age. There are different causes of hearing loss. The most common we think of is just the natural aging process, the gradual deterioration of the nerve. Hearing loss can occur throughout our lifetime. It is a process. Heredity can play a role. Exposure to loud noise is actually one of the most common reasons for hearing loss. And again, that can be at any age. Hearing loss that's caused by loud noise exposure is actually the only preventable type of hearing loss. So we do want to protect our ears from that loudness and the duration over time. We'll talk about some other factors as well that may be contributing to hearing loss. There are actually different types of hearing loss. The most common that we see with adults, about 95% of adults that have hearing loss have what's called nerve damage. You may have heard of nerve deafness. That's also considered to be sensory neural hearing loss. And again, that's just a deterioration of the nerve. In children, it's more likely that they have a conductive hearing loss, which just means something may be impeding the flow of sound through the eardrum. They could have ear infections, of course, fluid in the ear, ruptured eardrums, and even earwax, which of course we see that in adults as well. And then there's a small component of what we refer to as mixed hearing loss, which is a combination of both. But again, the majority of hearing loss that we see in adults is permanent. It's the nerve damage. It's not something that can be surgically or medically corrected. As of now, you know, research continues and has been ongoing for many years, how to regrow those hair cells in the inner ear. But as of right now, we have not come up with a cure for the sensory neural hearing loss. One thing I did want to mention, if you have a sudden hearing loss, this is more less common. But if you know, it usually happens when, let's say, you wake up in the morning and you notice that you're not hearing maybe out of one ear. A lot of times there could be vertigo or dizziness associated with those sudden hearing losses. It is important to seek medical attention. Your primary care doctor could be a resource, but more likely than not, you'll need to see an ear, nose, and throat physician and get started on a steroid regimen as quickly as possible. It is sometimes treatable when it's caught within the first 24 to 48 hours. So again, it is very important. And that again is a sudden type hearing loss. Usually it's just in one ear, may have ringing or buzzing in the ear. Again, may be associated with balance or dizziness, but definitely need to have that checked out medically as soon as possible. So a few symptoms of hearing loss, and for anyone that's experienced this either themselves or from observing loved ones or friends. And a lot of times I think the family and friends are the ones that point it out to the person that's experiencing the problems, because of course we want to deny that we're having issues and maybe put it off and just say, oh, it's not important. But a lot of times, you know, that they're requiring you to repeat yourself. So there's more effort to communicate. They might hear but not understand. That's a very common phrase that I hear, is, you know, I can hear the sound, but I just can't make out the words. maybe having trouble with the television, again, turning up the volume on the telephone, having more trouble, and in groups or background noise. That's another very common complaint that I hear is it's a lot harder in those group settings or those restaurants or those noisy settings. Again, they may be asking people to repeat themselves and may find that they're avoiding interactions, and especially in the more difficult situations, which we'll talk a little bit more about later, but may say, oh, go without me. I don't want to go to the movies, and maybe it's because they know they're not going to hear the conversation, they're not going to hear the dialogue, and so they just kind of withdraw themselves from those situations. One thing I say is if you think the birds have stopped singing, then it may be time to have your hearing checked. Birds and other sounds in the environment are typically high-pitched sounds and sometimes may be softer or more distant, may not be aware of what you're not hearing. So again, a lot of times we shrug it off, it doesn't hurt, it's not causing us, let's say, any physical pain. So what's the big deal, if I don't hear well? Well, we're going to talk a little bit about how hearing loss can be associated with some other symptoms or other things going on at the same time is called a comorbidity. So maybe going on successively or at the same time, but how it's related to social isolation, loneliness, depression, the risk of falls and balance prevention can be related to cardiovascular issues, diabetes, and of course, cognitive decline and dementia is one that we hear a lot about. So this is just a graph, again, just illustrating that there are other comorbidities associated with hearing loss. So I think, again, with COVID in the past year and a half, we have been all very aware of the effects of social isolation, and especially for some of the adults that are in the senior communities where, they've been on lockdown, they've been on quarantine, and not being able to participate in some of their normal activities. But it is important that we keep ourselves engaged and we keep ourselves active, stimulating the brain and being able to participate in those activities. And again, sometimes people choose to, whether it's consciously or not, they choose to become more withdrawn or more isolated from those situations, again, because of their hearing. And there are many times when I've talked to patients over the years where they don't always put the two together. They just say, oh, I don't go to bridge anymore, I don't go to church anymore, I don't go to that restaurant anymore. And we dig a little deeper, and it really is because they know they're not going to hear well, and it's a struggle. So they just don't put themselves in those situations. So again, as we maybe withdraw from those activities, it's not uncommon. And again, in the past year and a half, I think we've all learn to appreciate our mental health a little bit more, but the anxiety, the stress, and depression, not being able to maybe be around your loved ones, not being able to participate in some of these activities. We're sitting at home all day and by ourselves, and it's not uncommon, again, that mental health part, but how hearing loss comes to play with that is, as I said, sometimes a choice that people are making, and just increases the risk of depression. Balance and fall prevention is a really big topic. Is really, it is important. And again, I think that does get people's attention. We know that the risk of falls increase with the aging population, and can be associated with hearing loss. There are other factors to be considered as well. But even people with a mild hearing loss do have an increased risk of falling. And of course, the older we get, those statistics are more likely to happen. And unfortunately, once someone has had a fall, they're more inclined to have more falls. And of course, that can just, set off a cycle of not very good outcomes sometimes when people, break a hip and go to rehab, and just what that all entails. So of course, our goal is to prevent that. And one way that we can do that is just to keep moving. Walking is if that's all you can do, then that keeps you moving. Physical therapy can be very good for a lot of people. Doing balance exercises. Some people have found benefits from doing Tai Chi and yoga. So again, it's just keeping healthy and keep moving. I think that's very important. And as it relates to hearing, again, our balance and our hearing mechanism are all located in the inner ear. So again, a lot of times the way the nerve is not being stimulated can have an effect on balance. And there are some studies that have indicated that by wearing hearing aids when there is hearing loss can help improve balance. That is still, of course, further research is needed on that, but very important. Cardiovascular, how it may be related to that. And again, when we talk about comorbidities, it's usually, the cardiovascular issue may be the underlying issue. And because of the blood flow, that can affect the blood flow to the inner ear, and that can affect hearing. The inner ear is actually very vascular. So for people that have had strokes or TIAs, those transient ischemic incidents with the blood flow being disrupted in the brain, that does a lot of times show up on a hearing test. So very important. Again, if we can just continue to be healthy, I think we all know what we should be doing, but not always as easy to do. Diabetes is also a very common comorbidity with hearing loss. People with diabetes are twice as likely to have hearing loss as those without. Again, as it relates to the blood flow, with diabetes, we very often we think about vision, and we think about neuropathy in the feet, what we call those end organs, and the blood flow as it's affected from the diabetes. But the ears, again, are also part of that as well. So I would say if you're diabetic, it might be a good time to at least have a baseline hearing test and monitor your hearing every couple of years to see if it is being affected. It's much more likely that people that don't control their diabetes properly are going to have the effects of the hearing loss as well. And again, the one that seems to be getting a lot of attention, and this has been for several years, so not really new, but many studies have been done and replicated that indicate that the more severe the hearing loss, the increased risk of having some cognitive impairment, cognitive decline, which ultimately can be associated with dementia and Alzheimer's. So again, the more likely or the more severe the hearing loss, the more likely that risk increases. But even those with mild hearing loss were found to be twice as likely to develop dementia as compared to those with normal hearing. It is something that I use to educate my patients, but it's not something that I would ever tell someone, you have hearing loss, and if you don't get hearing aids, you're going to develop Alzheimer's. That is not the takeaway. That is not the message. But again, to educate people that there is definitely a connection between untreated hearing loss and the accelerated cognitive decline. So a lot of times, people say, well, what does my hearing have to do with my memory? That's my brain. And again, going back to the video, we can see how the brain is very connected to the ears. And this is a pretty typical example that I have with my patients, where we'll be conversing about some of their challenges, and something may come up where my wife said, I told you that, and they have an argument because they say, no, you didn't. And one of my favorite phrases from many years ago, one of the seminars that I went to, was, you can't remember what you don't hear. And, in a way it sounds very simple, but on the other hand, it's pretty profound. If you're having a conversation with somebody, maybe you're not paying attention, and, they're talking in the background, and you might just nod your head and say, okay, you don't know what you just agreed to. But the next day when it comes up, you're not going to remember it because you didn't hear it, you didn't process it, you didn't understand it. It literally has no meaning. So it's not going to be in your memory to retrieve that information. So, when we talk about the frustrations and the arguments that come sometimes, especially, as I said, with family members or friends, it is important. So it's all connected. That's kind of the takeaway from that. Another way that we think about the brain is the ability to reorganize, and this is referred to as brain plasticity. So if you've ever heard use it or lose it, a lot of times we think about your muscles, and if you don't use a certain muscle, it'll atrophy over time. But in the brain and with the nerve, the hearing nerve, if we're not keeping that nerve stimulated properly over time, the brain has a way of reallocating that part. So as your hearing deteriorates, the parts of your brain that process the auditory and speech sounds are not receiving the input. So again, they're not being stimulated properly from the ear, and therefore they're not being used. And over time, those structures of the brain are reorganized or assigned to other functions in the brain. So it is all connected. And we know that hearing loss can lead to people having a harder time concentrating, a slower ability to process, again, as that's related to cognitive decline. An example of that, if you're having a conversation and you miss a word, your brain is thinking about, okay, what was it in the context of the sentence, trying to figure out what that word was. But now the person is already 2 sentences ahead, and you've already missed that part. So again, that might lead to you asking to repeat something because you didn't hear it, you weren't able to process it. It's just more difficult, and there's more effort to hear and to understand when you have hearing loss. So as those parts of the brain become weaker, we're trying to focus more on hearing, and so it's using more energy, again, that effort to understand. So the areas of the brain that would typically be used for higher level thinking, they're trying to, help out, if you will. So again, that's leaving less in the working memory part of the brain, again, making it harder to understand that information. So that's one way that we think of the cognitive decline as being associated with that. And I like to say, sometimes that's why it's harder for you to multitask. We can only focus on one thing at a time. It's taking more effort, it's taking more energy from the brain to do those things that we used to be able to do 3 things at once. So our brain is pretty amazing, to say the least. This is a really important study done by Johns Hopkins many years ago, and has been replicated. Older adults with hearing loss are more likely to develop problems thinking and remembering than the adults whose hearing was normal. Those who had hearing loss were significantly more likely to develop dementia over time than those who had normal hearing. And people, with hearing loss were at a 30 to 40% greater risk of cognitive decline than those that didn't have hearing loss. One of the takeaways from that, of course, is, by treating hearing loss, that could potentially help reduce the risk of cognitive decline and dementia. I think that's a good takeaway from that. One of the things that we talk about with hearing, sometimes when we're going over the results of a hearing test, auditory memory. When hearing loss happens very gradually, typically over a period of time, we may forget that the clock ticking makes a sound, or we might forget the sound that the refrigerator makes, or the sound of our keyboard, when we're typing. We mentioned birds earlier, the turn signal in the car. We forget that those things make noise. So the longer we go with not treating the hearing loss, usually the longer and it may be a little bit more difficult for people to adjust to hearing aids. So that's also something very important. As I said earlier, hearing loss can occur throughout our lifetime. So once hearing loss has been diagnosed, obviously that early intervention, that's one reason that's important, makes it easier to adjust to that. Another word that we use is auditory deprivation. So again, over time, as the brain and the ears are not being stimulated properly, and we talked about how the brain is reallocating that that part of the brain has more difficulty understanding and processing the information, and the person may have a harder time with understanding speech. So sometimes with hearing loss, yes, we do need to make sounds louder, and that's what hearing aids do. But the part of the brain that understands the information also, that may take a little more time for that to develop and to be able to remember and to be able to process that information. One of the studies that I remember from grad school, and I say back in the dark ages, it was in the 90s, but some of the research coming out of the 80s, when people were diagnosed with hearing loss in both ears, and very symmetrical, very even in most cases. For whatever reason at that time, they usually chose to fit one ear with hearing aids. So sometimes, it was, the weaker ear, or, flip a coin, which ear do you want to wear a hearing aid on? And then research would study those people over a period of time. Could be, for some people 5 years, for some people 10 years. But when they would come back and, recheck the hearing over time, the ear that was wearing the hearing aid maintained the ability to hear, or rather, I should say, to understand speech properly, whereas the ear that was not treated, even though the severity of the hearing loss may not have changed, may still be equal with the other ear, the ability to understand speech could, in some cases, be significantly reduced. So again, that auditory stimulation, keeping the brain, keeping the ears working, all connected. Again, just inserting a little humor, little cartoon there about reindeer. So I hear what I want to hear. Again, why is hearing loss important? What's the big deal? We've already talked about some of the health issues, but just for individual awareness and safety, what we were talking about, auditory memory. If something's making a sound, what is it? And if I don't hear it, then how do I know what I don't hear? So some examples, might be, and these are real world. As far as I'm concerned, I've been in these situations. If I'm knocking on somebody's door, but the TV is so loud that they can't hear me knocking on the door, to me, that's a safety issue. But just generally being aware of sounds, just thinking about if you hear a faucet leaking in the kitchen or in the bathroom, somebody with even a mild hearing loss wouldn't even be aware of that. And, you walk upstairs and you've got a flood in the bathroom, that's an issue. If you've got a pot on the stove, boiling and you don't hear it, that's a safety issue, I had a funny story a few weeks ago, pretty recently. I'd come in from walking Lulabelle, and I hear this strange noise coming from upstairs. Didn't know what it was. It was kind of a hissing, just a weird kind of a soft level sound. Didn't know what it was. I had a repairman out not long ago to fix a leaky faucet, actually in the bathtub, and I thought, oh dear, something's wrong. I go upstairs, go to the bathroom. The bathtub's fine, the faucet's fine, but I still hear this little sound. And in the little cabinet next to the bathtub, there was a bottle of mousse, don't ask me how, that had just somehow formed a leak and was spewing out, making this weird sound, but would not have been maybe a huge problem if I hadn't heard it, other than it would have made a mess. But again, people that have a mild hearing loss, would have never heard that. So you don't know what you don't hear. I know I repeat myself, but I just think that's so important. Can hearing aids help my brain? Again, we talked about if you have hearing loss, and early intervention and treatment is definitely to your benefit to help support the brain and maintain that cognitive function. When you're treating your hearing loss with hearing aids, of course, you're really making sure that your brain continues to be stimulated, it's receiving the sounds that it needs. That doesn't just mean that you're going to be hearing environmental sounds. We talked about how that's important for safety and awareness. But obviously the goal for most people is being able to communicate better and being able to hear in different environments. But what we don't think about sometimes is the effect that it really does have long-term on the brain, and it is in your best interest. It does help to reduce the risk of that cognitive decline that we talked about, and the brain being able to really just do its job the way it was intended to do. Research, of course, is ongoing with that as well. This is another study that was done a little more recently with the Lancet Commission, talking about dementia prevention, intervention, and care. They studied 12 risk factors that could help delay or prevent dementia. And of those risk factors, the number one treatable risk factor was hearing loss. So, you can't do anything about heredity. Of course, you can change your diet, you can stop smoking, you can be healthy. Those were some of the other risk factors. But again, the number one treatable risk factor that helped to slow down that decline was hearing aids. Using hearing aids appears to reduce the excess risk from hearing loss. Again, early adoption of hearing aids can help people have a higher quality of life, stay more active, and prevent some of those things we talked about earlier with isolation, depression, cognitive decline, dementia. So this is not just me trying to sell hearing aids. This is me trying to educate my patients to, again, the unknown, a lot of times, risk of delaying that intervention. So what can you do? The first thing, if you haven't had a professional hearing evaluation, I think it could be a good time to get that scheduled. If hearing aids are recommended, you should follow those recommendations, and you should wear your hearing aids consistently. Staying active, staying healthy, staying engaged, that really, we talk about quality of life, that's all very important. Ampdify is a website that actually is designed for people that have hearing loss. So it's working on auditory memory and working memory, and it's specifically it's brain games for people that have hearing loss. It's a really great organization. You can do it on your app, your laptop, your tablet. It's a good way to keep stimulated. One of the things I was going to say earlier was the conversation sometimes with family members when I'm seeing a patient, at the dinner table, dad is not engaging in the conversation because he doesn't know what people are talking about. So he's present, but he's not really engaging. So if you notice that, again, with yourself or a loved one, it probably is a good time to just get things checked out. If nothing else, as I said, have a baseline and see where we are, and we'll talk about those results and recommendations. So I wanted to tell you a little bit about Audiology on Call. As I mentioned earlier, started about a year ago, joined up with 2 colleagues of mine in different parts of Atlanta, and decided that providing home health care type hearing support was going to be our goal. We don't have an office. We don't have a brick and mortar. We are completely mobile, which I've really enjoyed. So again, our mission is to bring the same high quality hearing health care services to the patients in their homes. And of course, during COVID, sometimes that was difficult, but seemed like more of a need for that. But I'll say even before COVID, there were always those patients where we knew that mobility was an issue and transportation was an issue, just getting them to the office. So I think it's really opened a lot of doors for us to be able to see people who otherwise we probably wouldn't have been able to see. I feel like it's really kind of reinvigorated the passion that I have for helping people and wanting to help them hear better. And it's been a really great transition. So some of the services that we provide, we do come into your home or office if we have a quiet room, and that's we talk about that while we're scheduling the appointment, the importance of having that quiet room. We still use the same type of earphones or headphones that we used in the office. We have the technology to do the hearing test literally through our laptop, to go through all the testing, very comprehensive testing that we did in the office. And that probably is one of the most common questions that we get asked, and honestly is one of my questions when I was approached about doing this was, well, how does that work? How do we do that? I won't make you watch the video, but there is a page on our website that just walks you through a quick little video about how we're able to set up in a quiet room. There's also an article on the website about the consistency and the validity of our hearing test. So of course, that's very important that we're able to still provide, as I said, the quality that we did in the office. If hearing aids are recommended, of course, we do work with different manufacturers. We're not a franchise. We're not tied to any one manufacturer. We really want to work with you on an individual basis to choose what's appropriate for you. If you already have hearing aids, our goal is always to see if we can work with what you have. Sometimes it may need repair. Sometimes it may need reprogramming. If we can work with your current hearing devices and get you to a level of hearing that's appropriate, as I said, that's definitely our goal. Our hearing aid program and all of our prices actually are on our website as well. But by being able to reduce our overhead, we pass some of those savings on to our patients. So the cost of hearing aids, which we know has been expensive for many years, but that we've been able to reduce some of that cost as well. The repair and service, we talked a little bit about that earlier. If we need to send hearing aids in for repairs or reprogramming, we can do that. We also do wax removal. That's pretty common as well. We have all the tools to allow us to do that, and assistive listening devices. Sometimes, in the past, someone might purchase a TV streamer that sends the signal directly from the television into their ears. And I would hand them the box and say, good luck, I hope this works, I hope you're able to get it connected. But now I can actually go into someone's home and install it and make sure that it works. So I enjoy that as well. Talking just a little bit, about hearing aids and technology. I've been doing this, I think, 28 years now, and hearing aid technology has come such a long ways. I never say it's perfect. It's certainly not replacing what we were born with, but even just the technology that we have today compared to the technology that we had 5 years ago is really amazing. The sound processing, the sound quality, the hearing aids are a lot smarter. As I think of it, they are little computers in our ears, and they're able to make those adjustments. Literally millions of calculations and adjustments per second. So they are really amazing. A lot more options now to use Bluetooth for connectivity for some people. That really helps them hear on the phone a lot better. We have rechargeable options. So people that would have had difficulty with changing batteries, either due to vision or dexterity, or sometimes, again, the not having the ability to remember that they need to change the batteries. And then when we talk about the hearing aids being smarter, they're actually using machine learning algorithms and artificial intelligence. And when we think about that, what does that mean? It's not a robot, it's not science fiction, but we've been using machine learning for years. When you watch something on Netflix or Amazon Prime, or you listen to Pandora and you like it, it's using those algorithms to say, well, here's some other things in that same category that you might also enjoy. So with the hearing aids, if you're in different in environments, and it's finding a pattern, or you're making certain adjustments for volume or for background noise, the hearing aid learns those patterns over time, and I think that's really amazing as well. There are some hearing aids and some in the works, research still being done on others, where they're actually kind of becoming more like health devices, kind of like your Fitbits. But again, talking about falls and being able to detect a fall and alert people when that happens. That might be, again, in the early phases, and something we might see more of in the future. So again, I think it's exciting. A topic that's been pretty common in the past 6 months is the talk about the over-the-counter hearing aids. I am not really a proponent of that. I have an article on the website about it as well. Hearing aids are regulated by the FDA as a medical device and have been, I think, since the 70s. But there's also, there have been mail order hearing aids on the internet and the magazines and the TV commercials, for years, and they're amplifiers. They have not been classified as hearing aids. Hearing aids are not one size fits all. It is a customized device, and part of the cost of hearing aids is not, when I talk to people, I say it's not just about that little piece of plastic that goes in your ear, but it's about the services and the expertise of the person that you're working with, and being able to make it work for you. So I do think that's important. There certainly could be a percentage of people who maybe that is just a more affordable option, but I hope that if they do have a bad experience, that they won't, that they'll continue to seek out services from a professional. So it's a hot topic right now, and I like to say, if it's that easy, anybody could do it. So I remember a conversation my dad actually had with one of his physicians. The doctor comes in, talks to him for 5 minutes or whatever, and the bill $200. I don't know the details, but you're not paying for the minutes. You're paying for the expertise and the years and the experience of the person, whether it's a mechanic, whether it's a physician, whether it's your audiologist. And I think that's really important to remember. And I've had many patients over the years tell me, you make that look really easy. And especially if they've been somewhere else and had a different experience. So I do take that as a compliment. One of the other more common questions that we get asked is about Medicare. And Medicare really only covers for medical types of testing or hearing loss, and specifically says that they don't cover hearing testing exams specifically for the purposes of fitting hearing aids. Hearing aids are not covered. The exams are not covered, again, without medical conditions, which is very rare. There are some Advantage plans. I know, see the commercials, and I've worked with some in the past that offer benefits, but most of those plans are more of a discount plan, so you're still having to pay out of pocket. Currently, we are not accepting insurance. Again, most of the benefits don't cover for hearing aids, and as we said earlier, our costs are reduced, and we'll have that conversation. So what is the process? You can always go to our website. You can call, you can email, you can find me, make an appointment. We'll go through the process, explain all the services, we'll explain the fees, answer any questions that you may have. And then again, we come into your home. We usually go to a kitchen table, dining room, again, somewhere for us to sit down and talk, have a quiet room to do the testing. That initial appointment usually lasts about an hour and a half. So it is very comprehensive, doing all the testing, talking about your challenges, talking about your goals for being able to hear better, going over the results, going over the recommendations. So again, it's very, very detailed, very thorough. In closing, just one of my favorite quotes from many years ago from Helen Keller. When you lose your vision, you lose contact with things. When you lose your hearing, you lose contact with people. If you are looking at me and you can't see me very well, it doesn't affect me at all. But if we are talking and you don't hear properly, then your problem becomes my problem, and the two of us have a communication problem. So a hearing problem not only affects you, it affects those around you. And that's why I said earlier, sometimes they're the ones to maybe actually point it out to you that maybe you are having some challenges. So it is very important, and communication obviously is very important. Again, some words that I've heard over the years. I don't claim to be a miracle worker or a marriage counselor or a magician by any means, but it is amazing the difference that we make in people's lives when they can hear better, they can communicate better, they improve those relationships, quality of life. I really do want to be your hearing healthcare partner. I really do want to be your friend and help you hear better. That's my goal. And in parting, one last cartoon. The guy says, I had my hearing checked last week. Turns out I have a hearing loss in one ear. And his buddy says, oh, really? Which ear? He says, my left ear. And he says, oh, well, that's too bad. I'm lucky because my hearing loss is in my right ear. And his friend says, well, what difference does that make? And he says, a big difference. It saved my marriage. When my wife and I are in the car and she starts to tell me how to drive, I just say, sorry, honey, that's my bad ear. So yes, I do have a sense of humor. I hope you enjoyed the presentation. These are some of my sources for the information that we talked about today. And contact information. how you can reach us, check out our website. You can email me, text me, call me. I am available with Audiology on Call. And I did just want to say one more big thank you to Annette and Christine for having me today and for making this happen. And I hope you've enjoyed the presentation, and I look forward to speaking with you soon.
Wonderful. I wanted to say thank you, Kelly. I do have a question though, because I've heard that your ear is very similar to your fingerprint. Like there are no two ears exactly the same. So I think to your point of making sure that people are fitted properly for the right hearing aid to make sure that it's the best one, most useful for them is super important. But is there, because of the dementia correlation or the parallel with hearing loss and cognitive issues, is there anything on the horizon where the government, Medicare, will look at the hearing aid devices and look at insurance for that? Because with that direct correlation, I just think it would be super important.
Yeah, I do think that's probably in the works. And I always say, be careful what you wish for. In the article that I was referencing that's on the website, and go into some of the details, I do think there should be some assistance, absolutely, with insurance. But I don't want the insurance company dictating to me what I can put on my patient. So, do I think it will change? Probably, yes. And I think that was kind of possibly part of the reasoning behind the initiative with the over-the-counters to make them more affordable. But I don't think people are going to get the service. That's just my fear, that they're going to go buy this widget in the Walgreens and go, well, it didn't help. And
right.
So I think there should be some assistance, yes, and possibly coming in the future. I don't know.
And I think that's so important to have somebody like you that can come and check on these folks that have hearing aids, because I know that in my family we've got wax buildup quite a bit. So and I'm sure that winds up working its way into the inner workings of a hearing aid. So it would be important to have those serviced regularly. And I think people don't necessarily do that. And they are so delicate that I love the hearing aids that can be recharged versus using the batteries and all of that, because, even myself now needing glasses and stuff like that, it's really hard to see. So I love that advancement and think that, the technology that you were talking about, the AI, is just going to be huge. I love the fact that it might be able to detect a fall soon.
Yeah.
So again, Annette and I appreciate you coming on, and I know that I will share this with many families. So thank you so much for all that you do for your current families that you help, and then the future families that you will be helping.
Thank you.
Thank you so much, Kelly. We appreciate your time and your expertise.
Thanks for having me.
All right. Thank you.
Bye.